Okay, we went over a few of the massage techniques, and I just want to mention some of the terms, including, as we mentioned earlier, centripetal. Massage on the limbs is termed centripetal if it strokes toward the center of the body, so from the limbs to the center of the body. And then mechanical and reflexive, right? Mechanical means the primary response to tissue manual manipulation, what the hand does to the body. Reflexive is the secondary or involuntary or reflexive responses of the nervous system from a stimulus. It's how the body responds over time, or how the body responds to the massage technique. Down here, I mentioned extensibility, which is the property of being able to be stretched or shortened. So if something is extensible, it can be elastic, it can be plastic, and those are terms that we'll probably go over, but I just want you to know, in the context of because it's mentioned down here in some of these techniques, that extensibility means it means kind of like pliability, except broader, actually. So let's now go to some massage technique questions and practice those. And again, this is massage techniques questions AMTA, and that's in your MBLEx drive. Massage techniques questions AMTA, right there, right below massage techniques. Okay, I'm recording. Let me hide this so I can make it bigger. Okay, so number one, fill in the blank. Blank can be light, moderate, deep, or variable. If you guys want to unmute and call out, you can. Blank can be light, moderate, deep, or variable. Would that be trigger points, drag, compressive force, or holding? Which one do you guys think it is?
Trigger points.
Okay, let's check the answers. All right, so the answer is compressive force. So since some of you think it's trigger points and some of you think it's holding force, let's read through the explanation. So these questions are a good opportunity to figure out what it is you know and what you don't. Dominique, I was telling people you came in after I told people that that this section, the benefits and physiological effects of techniques that manipulate soft tissue, this section, probably you will be golden if you have one lecture, which is today. If you have one lecture and then you just go through the questions on your own as a way to learn and refine, right? And then these other three sections: client assessment, ethics, boundaries, laws, regs, guidelines for professional practice. Those I think you can prepare for the MBLEx just fine if you only do questions on your own. Like, you probably don't even need me to walk you through those, although you do need to practice them. And it would be helpful if I touched on them somewhat, like for, one session or half a session. We only have two left, but this one, benefits and physiological effects of techniques. That one, as long as you practice the questions on your own, you can make that your primary means of learning. But anatomy and physiology, kinesiology, and then pathology, those we have to cover specific stuff. Like, we have to go through all the medications, and we have to go through different kinds of movements and ranges of motion. We have to go through the body systems. Those you cannot learn by just drilling questions over and over and over again, even though many MBLEx practice websites will tell you the best way to do it is to practice as many questions as possible. I have not found that to be the case. Okay, so the answer for compressive force can be light. Yes, compressive force can be light, moderate, deep, or variable. Compressive force or depth of pressure can be light, moderate, deep, or variable. The massage therapist may choose which level of pressure to use based on the treatment goals. Drag is the amount of pull or stretch that is placed on the tissue, because drag refers to force applied in a transverse direction. Depth is not an accurate measure of its intensity. Trigger points may occur deeply or superficially, but they're not described as being light or moderate or variable. And then holding techniques are static. They can be light or moderate or deep, but not variable. So the question includes variable. Blank can be light, moderate, deep, or variable. Sounds like some of you focused in on like one or two words or excluded one or two words in your thinking. And this is just demonstrates once again, you have to read every single word, and sometimes the words really give you a clue. All right, a massage therapist is developing a treatment plan for a client. Of the following, which is the best example of a quantifiable goal or outcome? Notice that this question is from the AMTA in the massage benefits and physiological effects of manual techniques section, but it sounds an awful lot like an assessment or reassessment question, doesn't it? So which is the best example of a quantifiable goal? Is it to increase shoulder range of motion by 20 degrees to allow for stretching overhead? Is it need a reassessment of range of motion in 10 visits? Is it return to independence with washing hair, or return to normal activities of daily living? What's the best quantifiable goal?
Increase shoulder flexion range of motion by 20 degrees.
Yes. And yes. And why is that? Why is that one the best answer?
Because you want to work on it a little more for the ease into being able to reach out. I mean, to stretch it more.
That's a good clinical thinking. It shows you have a knowledge base, but
it's a more clear goal, I feel like, because need a reassessment of range of motion in 10 visits isn't very foreseeable, I guess.
That's right. That's right. But I want you to be more specific in your terms as they apply to the question. Take them from the question. It's quantifiable, quantity. What do you think of when you think quantity? If somebody says, I'm not about quantity, I'm about quality. First of all, you know. But second, quantity means measurable. How many, right?
Yeah.
So shoulder range of motion by 20 degrees, that's a very specific measurement, right? To reassess in 10 visits is not a quantity. Don't be fooled by the number 10. It's saying need a reassessment. That's not measuring anything. It's just telling you what to do in 10 visits. Independence with washing hair, that's like pretty broad. You can wash your hair this way, or you can wash it like that.
Yeah.
Return to normal activities of daily living, also too broad, not quantifiable, not measurable enough. Okay, of the following options, which is the best definition of a trigger point? Is it a buildup of lactic acid, a pathology that produces referred pain, a discrete area of pain and or tenderness in a band of dense muscle tissue, or is it an adhesion between two different muscles?
A discrete area of pain or tenderness in a band of dense muscle tissue.
That's correct. That's correct. You'll also hear it referred to as a hyperirritable location or locus. Locus and location are the same. Hyperirritable locus. Okay, fill in the blank. When performing hot stone massage, it is important for the therapist to place the stones directly on the client's skin, cool the stones to a temperature between 90 degrees Fahrenheit prior to each massage, sanitize the stones prior to each massage, or not use gliding strokes, as this may cause too much inflammation.
Sanitize.
Sanitize. That's right. That's right. Fill in the blank. Ayurvedic massage is most often performed on the foot. This modality uses a map of the foot to show which areas affect different parts of the body, or reflexology, or acupuncture, or Reiki.
Reflexology.
We have a consensus. Awesome. Which of the following is not a massage benefit for one's skeletal system? Stimulates the sensation of touch, improves the range of motion of joints, improves the joint's flexibility, improves the spine's curvature.
Stimulates the sensation of touch.
Yes.
Hey.
Yeah. Okay. Why is that? Why is that not a massage benefit for one skeletal system?
Because you're basically moving around the joints and not really touching. I mean, not rubbing or anything like that.
No. Rosie, read these first three words.
Sensation.
Yes. Which body system deals with sensation and stimulation? It's the one that has the sensory nerves and the sensory,
Okay.
that's the nervous system.
Nervous system.
Nervous system, yes. Why is massage an important part of a wellness program? It increases tension and extreme alertness. It creates stronger muscles. It restores body balance and provides a connection with other human beings. It promotes insomnia.
C.
B, it creates stronger muscles.
C.
C, restores body balance and provides a connection with other human beings. How does massage benefit the urinary system? It increases body awareness. It stimulates the release of endorphins. It promotes a calming effect. It aids with the elimination of surplus fluids and toxins from the body.
D.
Aids with the elimination of surplus fluids and toxins from the body.
Yes. What body system deals with body awareness? That's like proprioception, temperature, being aware of
Nervous.
feelings, the nervous system. How about the release of endorphins? Which one regulates the release of endorphins? Also the nervous system.
Right.
Also the nervous system, and then provides a calming effect. Which system would allow you to perceive calm
Nerve.
or
Nerves.
stress? The nervous
Okay.
system. That's right. That's right. How can massage therapy help the impairments sustained after a person has been seriously burned? Okay, think about a burn. How can massage therapy help the impairments sustained after a person has been seriously burned? By
Mhm.
activating them. Okay, by strengthening connective tissue. Yep, by improving connective tissue mobility, by weakening connective tissue, or by activating the muscles under the burn. You still think it's B, Emmy?
Yeah.
Mobility.
What's that, Rosie?
By improving connective tissue mobility.
That's correct. That's correct. So it improves connective tissue mobility. So after a person's burns begin to heal, the scars can contract and pull the surrounding tissues. Sometimes people with these burns can experience contractures, a condition in which a joint can become stuck and cannot move as a result of immobility in the connective tissues. The areas surrounding the burn can feel very tight, so massage therapy can help to improve the mobility of this tissue. Myofascial release techniques can be especially helpful in this scenario. The connective tissue that's laid down initially after a burn scar can become very strong and limit the range of motion. Massage does not strengthen this tissue. While there may be some difficulty with muscles underlying the burn, depending on how deep the burn is, the primary impairment after a burn is lack of mobility, lack of soft tissue mobility. While some massage techniques will improve connective tissue mobility, they will not weaken the tissue. So it does not strengthen connective tissue. It does not weaken connective tissue. Activating the muscles underneath the burn is not a priority. It's improving connective tissue mobility. It's a little tricky because it says after a person has been seriously burned, and it sounds like they're talking about weeks and weeks after, but they don't specify. Massage benefits many systems of the body of the following. Which is a benefit of massage to the muscular system? Is it that massage removes toxins and metabolic waste? Massage maintains healthy skin. Massage relieves the inflammation of tendons, or massage promotes the release of endorphins. Benefit of massage to the muscular system.
Massage relieves the inflammation of tendons.
Very good. Very good. Fill in the blank. When trying to promote venous return, the massage therapist should apply strokes to the extremities, moving venous return. Do you want to move away from the heart or toward the heart in a circular motion or laterally? When you hear venous return, where are you returning it to?
To
The heart.
Toward the heart, correct. So
Yes.
toward the heart. Correct. And from the limb toward the center of the body, is that centripetal or centrifugal? Centripetal, yes.
Okay.
Which of the following would be most appropriate area? Which of the following would be most appropriate areas to apply shaking. Which of the following would be the most appropriate areas to apply shaking? Lumbar extensors, tibialis anterior, hamstrings, or cervical suboccipitals? Which one?
Hamstrings.
Let's see. It's the hamstrings. Yeah. Shaking is used on large muscle groups and the appendicular appendages. So arms and legs, appendicular synovial joints. Remember all the joints that provide the most movement in the body? Those are synovial joints, right? So the fingers, wrist, elbow, shoulder, hips, knees, ankles, and toes. The hamstrings are a large muscle group and can be grasped and manipulated effectively for shaking. This technique can help reduce muscle tone, warming the body and preparing muscles for deeper massage techniques. Other areas that are appropriate for shaking are the shoulder area, the upper trapezius, biceps and triceps, quadriceps, and gastrocnemius. The lumbar extensors and cervical suboccipitals cannot be easily isolated and therefore cannot receive shaking techniques appropriately. While the extensors may be large, they would be difficult to grasp for this technique. Although the tibialis anterior may be able to be palpated easily, it also cannot be grasped for this technique, and so would not be an appropriate area for shaking. Fill in the blank. Massage is known to detoxify the body by blank. This primarily benefits the blank. So is it promoting lymph circulation, benefiting the lymphatic system, promoting lymph circulation, benefiting the vascular system, inhibiting lymph circulation, benefiting the lymphatic system, inhibiting circulation, benefiting the integumentary system?
Promoting lymph circulation, the lymphatic system.
Yes, I think so. Okay, great. You guys, please let me know if any of these, if I skip anything, if I move on from a question and you want to spend more time understanding it, let me know. A massage therapist has a client whose lower body is paralyzed due to a spinal injury at the level of L5. This client uses a manual wheelchair. Of the following options, what is the most likely goal of massage for this client? Reducing tension in the shoulder as a result of daily wheelchair use. A person with this condition is not an appropriate candidate for massage. Improving activation and tone of the shoulders, stimulating a local inflammatory response in the quadriceps.
A.
Reducing tension in the shoulder as a result of daily wheelchair use. Yeah. Okay. Jessica, are you available?
Yes.
In which form of massage application is lubrication generally not used? Skin rolling, kneading, myofascial release, or effleurage?
Myofascial release.
That is correct. Dominique. Dominique.
Yes, sir.
A massage therapist is employed at a sports performance center. She is working with an athlete who wants to increase circulation to her muscles to prepare for a volleyball game, which will begin in 1 hour. Which of the following techniques are most appropriate for this massage? Broad-based compression, shaking, and tapotement, focused trigger point work, aggressive tapotement, lymphatic drainage, or muscle energy techniques?
Muscle energy techniques.
The answer is broad-based compression, shaking, and tapotement. So let's go through each one of these. Sports massage, everybody misses this one, by the way. Sports massage is usually intended to help the client prepare or recover from an event. It may also be helpful for athletes recovering from injuries. When performing massage on an athlete anytime in the 24 hours prior to an event, the therapist should exercise caution. The goal is to improve circulation and energize the athlete's muscles. This is not an appropriate time to treat injuries or underlying conditions because such focused work may leave the client feeling sore. This type of massage can sometimes be appropriate for athletes, but should not be performed immediately before or after a competition. So that doesn't go specifically into the others. I think you understood focused trigger point work and aggressive tapotement probably would be too lengthening and releasing for someone who needs to have active responsive muscles. and make them sore. Lymphatic drainage probably wouldn't be that effective beforehand. Let's see if we can find some specific information on muscle energy techniques. Muscle energy. So there is one. This is the FSMTB MBLEx question practice exam. This is in your drive. And if I hit like Command F or Control F or whatever, and put in muscle energy, I think I find like one question, and it's down here. So the purpose, and it's perfect one to help clarify, Dominique. So it's the purpose of applying muscle energy techniques in a session is to change a muscle's resting length. To change a muscle's resting length. So in other words, sometimes you stretch a muscle, and when you let go, it returns back to its original length. It shortens again. And muscle energy techniques are meant to encourage a muscle to retain the lengthening that you do through things like stretching or range of motion movements. So it's to change a muscle's resting length.
Thank you.
You're welcome. Let's skip cryotherapy, vibration and rocking. Good. Vibration and rocking are examples of oscillation. What, if anything, is the difference between these two massage techniques? Vibration is just another word for rocking. Rocking is a smaller, faster oscillation than vibration. Vibration is a full body technique. Rocking is only performed on individual limbs. Vibration is a smaller, faster oscillation than rocking.
Vibration is smaller, faster. Oscillation.
Oscillation. Yes, very good. Very good. Oscillation is a style of massage in which the therapist moves the client's body or body part back and forth. During vibration, this movement is performed quickly, is usually performed on the entire body at once, often with the same rhythm as the client's pulse. Vibration is a smaller, faster oscillation than rocking. Which of the following techniques has the greatest effect on fascia? Great question. Petrissage, tapotement, effleurage, or friction?
Friction.
The answer is friction. Yeah, tapotement is used to stimulate the nerves and also to dislodge or release phlegm. Effleurage or gliding applies light to moderate pressure to superficial structures, including the skin, fascia, and muscles. Although petrissage or kneading does have an effect on fascia and tendons, it primarily targets the belly of the muscle. So good distinctions there. Let me just see if I marked any of these as like especially tricky. Sometimes I do that with like color. No, I didn't do that. Okay, but we're almost done. It looks like, yeah. Okay. For which of the following conditions is the use of hot stone? I'm sorry. For which of the following conditions is the use of hot immersion baths contraindicated? Is it venous insufficiency, osteoarthritis, Raynaud's disease, or multiple sclerosis? Hot immersion baths contraindicated. Which one? So heat is going to what? Dilate or constrict the blood vessels?
Veins.
Are you saying the answer is venous insufficiency? Okay, so heat would dilate the blood vessels, vasodilation, and it would relax or release the muscles or reduce muscle tone. So which one would this? It would also heat up the body. Which one would this be a bad idea for? Venous insufficiency?
I think
No,
will be
you'd be
venous
helping.
insufficiency.
I don't think so. Contraindicated. Contraindicated. So contraindication means do not use massage. Right. So the answer is multiple sclerosis. Multiple sclerosis is a neurological condition that involves demyelination of the central nervous system. So the central nervous system is becoming slower and starting to break down. Individuals with this condition have a reduced tolerance to high temperatures. So that is specific to multiple sclerosis. That's almost like a pathology section question. Right, so you're seeing some overlap between pathology and the benefits. But it's a piece of information which is relatively easy for you to take in and hopefully remember. Individuals with this condition have a reduced tolerance to high temperatures. Exposure to high temperatures will exacerbate their symptoms. The application of heat, including immersion baths and the use of saunas, is contraindicated for these clients. While Raynaud's disease is a circulatory disorder, the main issue is with cold exposure, not heat. Another piece of information to try to remember. Venous insufficiency involves difficulty returning venous blood to the large blood vessels and heart. Heat is not contraindicated for people with this condition. In fact, it may be helpful. There is no such contraindication for individuals with osteoarthritis. Heat helps venous insufficiency, not contraindicated with osteo. Raynaud's disease is primarily cold. Multiple sclerosis patients are vulnerable to heat, vulnerable to hotter temperatures. Okay, that's it for the massage techniques. Let's do some agonist, antagonist, eccentric, concentric work. Give me just a moment. I'm going to pause the recording because I need to actually hook up my battery to the camera. So pause the recording. I'm going to switch the. Out of the way. Okay, so let's start at the top of the neck. So I found that when trying to discern concentric and eccentric, agonist and antagonist, it helps to think about which side is shortening, which side is lengthening. So I think the most helpful thing is simply for you to look at the front versus looking at the back of the body, right? And just think about it that way. Like, is it the front that's shortening? Is it the back that's shortening? Right? Is it the front that's shortening? Is it the back that's shortening, like that? And then you decide which is the agonist, which is concentric, etc. So yesterday we did, like we said, neck flexor and neck extensor for the neck. But today I want you guys to say longissimus or longissimus coli. So longissimus in the front, which is one of the deep neck flexors, and I want you to say splenius for the muscles in the back, just so you can start to practice those names a little bit more. All right. So let's start with front and back. So which surface is shortening, the front surface or the back surface right now?
The front.
The front surface. That's right. The front is shortening. So would that be concentric contraction or eccentric contraction in the front?
Concentric.
Concentric contraction, that's correct. Concentric in the front. Would that be the longissimus or the splenius in the front?
Splenius.
The
The splenius is in the back. The splenius is in the back. The longissimus is in the front.
of this.
So the longissimus in the front, right? That's correct. And is the longissimus the agonist or the antagonist?
Agonist.
Agonist.
Correct, correct. What's this motion called? Is it called flexion or extension?
Flexion.
Yes. So if you see it written on the test in neck flexion, which of the following muscles is the agonist or the prime mover? Is it the longissimus or the splenius? What would your answer be?
The long.
Longissimus.
The longissimus, that's correct. And if it says in neck extension, which would the antagonist be? The longissimus or the splenius?
This.
Wait, in extension.
In neck extension, which would the antagonist be? Says switch the pattern.
Then it would be the long.
That's right, the longissimus. Emmy, I want you, Emmy, you guys also, not just Emmy, everybody, you guys have to be doing this in the exam. You have to be, okay, neck extension is this way, this is short, this is long, this is the longissimus, which is the antagonist.
Okay.
Rosie, sounds like you have a conversation with yourself over there.
I was repeating what you were saying.
Okay, all right, fine. Good way to practice, Rosie, for sure. Okay, so neck extension, which one is the agonist? The splenius muscles or the longissimus?
Splenius.
Oh, good.
That's right. And of course, the splenius is shortening, not lengthening, right?
Right.
Okay, now we're gonna do the did we do pecs yesterday? I can't remember. Okay, let's skip the pecs and do the shoulder. So this is shoulder extension, this is shoulder flexion, right? So for shoulder flexion, which surface is shortening? The anterior surface, the front or the back? Front or the back?
Front.
The front, is that the anterior deltoid or the posterior deltoid that's short?
Anterior.
And does that mean the anterior deltoid is contracting concentrically or eccentrically?
Concentric.
Yes, and is it the agonist or antagonist?
Agonist.
And when you have an agonist, is it the prime mover or is it?
Prime
not
mover.
prime? Yes, that's correct. That's correct. Okay, and then which muscle is contracting eccentrically right now?
The posterior deltoid.
That's right. And the name of that muscle or the role it's playing is what? Not agonist, but
Antagonist.
antagonist. Very good. Okay, external rotation of the shoulder, internal rotation of the shoulder. External rotation is accomplished by what muscle? The infraspinatus or the subscapularis?
The subscapularis.
External rotation, external rotation.
The subscapularis is
Infraspinatus, infraspinatus. Subscapularis does internal rotation. This is external rotation. We did this way yesterday, so let's do it this way this time, okay? So external rotation, infraspinatus, internal rotation, subscapularis, external rotation, infraspinatus, internal rotation, subscapularis. So with internal rotation, which muscle is shortening? The infraspinatus or the subscapularis? Which muscle is shortening? Internal rotation, subscapularis.
Subscap. Subscap.
External rotation, infraspinatus. Internal rotation, which muscle is shortening?
Subscap.
Is scapularis.
Subscapularis, yes, which makes the nature of the contraction concentric or eccentric?
Concentric.
And that's the prime mover, is it not?
Yes.
Which muscle is antagonizing the subscapularis in internal rotation?
Infra.
The infraspinatus, very good. Antagonizing, and the nature of the contraction in the antagonist in the infraspinatus is what?
Eccentric.
Eccentric, okay. Sandra, Dominique, Jessica, you guys don't wanna participate in these? You're welcome to unmute. I mean, you don't have to, but you're welcome to unmute if you like. Okay, and then the other way, external rotation, which muscle is the antagonist in external rotation?
Wait, antagonist
Yes, the antagonist
in external rotation.
in external rotation.
I can't see you.
What? You heard the question. In fact, you repeated it. External rotation, antagonist. You can't see me?
Sometimes it like goes off. When somebody else talks, then I can't see you.
You gotta go to my image to the right upper corner to the three dots and press pin. See, pin the image.
Okay.
So for external rotation, let's do the agonist instead because it's hanging you guys up. So for external rotation, which muscle is the agonist? The infraspinatus or the subscapularis?
The infraspinatus.
And which one is the antagonist?
The subscapular.
Yes. Which one is contracting eccentrically and which is contracting concentrically?
Infraspinatus is contracting concentrically and the subscapularis is contracting eccentrically.
Very good. Very good. Okay. Let's look at a couple that we didn't do yesterday and then we have to stop. So shoulder elevation, shoulder blade elevation, and then shoulder blade depression. Shoulder blade elevation is accomplished by like 4 or 5 muscles. Let's just say the upper trap, okay? Upper trap for shoulder blade elevation. And shoulder blade depression, also multiple muscles, but let's say mainly the latissimus dorsi, all right? So upper trap, latissimus dorsi. So you have shoulder blade elevation. Which muscle is the agonist in shoulder blade elevation? The upper trap or the, oh, I'm sorry, wait. Which surface is shortening in shoulder blade elevation? The upper surface or the lower surface?
Upper.
Yeah, and which muscle is in the upper? Is it the upper trap or is it the lat?
Upper trap.
The upper trap. So which muscle is shortening?
Upper trap.
Upper trap.
Which muscle is the agonist?
Upper trap.
Upper.
Which muscle is the prime mover?
upper
upper
trap,
trap.
Yes, which muscle is the antagonist?
the lat.
Lower.
Yes, and it's lengthening, correct?
Yes.
Which makes that contraction eccentric or concentric?
Eccentric.
Eccentric.
Very good, very good. Okay, and now for shoulder blade depression. For shoulder blade depression, which muscle is shortening? Where's the shortening, in the upper or the lower?
Lower.
The lower.
Yeah, and what muscle is down there in the lower? Is that the latissimus dorsi or the upper trap?
Latissimus dorsi.
Correct. And where are and what is the nature of the contraction in each, concentric and eccentric?
Latissimus dorsi is
Is
concentric.
concentric.
Upper and the
Yes. And the upper
And then-
trap?
Is eccentric.
Upper is, yeah,
Upper trap is contracting eccentrically.
eccentric.
eccentric.
Yes. And which is the agonist and antagonist?
The
Latissimus dorsi is
is the agonist, and
Is
then
the
the
agonist?
upper trap is the antagonist.
Upper trap is the antagonist. That's correct. That's correct. Okay, one last one. One last one. We're a little bit over time. Here, go ahead and go with me too, but one last one. So there are muscles on the outside of the hip that do abduction, right? And muscles on the inside that do adduction. So let's just look at abduction because we're over time. So we have the tensor fascia lata or TFL and the glute min that do abduction. So where is the shortening in hip abduction? Where's the shortening, on the outside or on the inside, the lateral or the medial?
The lateral.
Lateral.
The lateral or the outside, yeah. And what muscles are over there? Is it the TFL glute min or is it the adductor magnus pectineus?
Adductor magnus.
No, those are over here. Those are on the medial side.
The gluteus.
The glute min and the TFL. Yeah, the
The
glute min and the TFL. Yes, for abduction. So, and those are shortening, which makes, so which one is the agonist?
The agonist is the lateral, the
Good, you're on the right track. Yeah, and the name of the muscles, or the name of one muscle?
glute,
TFL, glute min, pectineus, adductor mag.
gluten.
Gluten.
Glute min, very good. And which is the antagonist? Name one antagonist to abduction.
Is
Antagonist of the abduction.
is it, quadricep?
Magnus.
The adductor magnus would be one. Yes, the adductor magnus. So those fibers on the medial side, the adductor magnus, they must be lengthening during abduction, which makes the nature of the contraction what? Eccentric or concentric?
Eccentric.
Very good. Very good. Okay, that's all that we have time for. I'm sorry I did not record the cardiovascular portion of today's lecture. That was my mistake. But I have the cardiovascular from other lectures, so I'll send you a link to the other videos so you can practice cardiovascular from that. All right.
Okay.
So guys, great work. Please come to the other classes. I'm going to try to start. Maybe I can include some information in the other classes that aren't included here, although it doesn't benefit the other class if I do that. Right. But I think the way that things have worked out, you guys have wanted to focus a little bit more on the muscular, like from the beginning, that was like, you guys said that you needed to know your muscles a little bit more. And then other people, they came in with that knowledge a little bit more secure. So things for this class have been the pace has been a little bit more focused on the muscles. So it may benefit you to go to another class. And I think you'll have more time for things like medications and assessment and things like that. So come to the Monday classes if you have a chance. Through May 3rd, I'm teaching Mondays and Wednesdays from 6 p.m. to 8 p.m. The same link, there's no charge. All right. And if you can't come to those, the videos will be on YouTube, and I'll send you the links for those too. All right, guys.
Okay.
Thank you.
So have a great weekend. What's left of it. Get some rest, and I will see you guys very soon. Okay.
Thank you. Bye.
Hey, thank
You're
you.
welcome. Take care.